Improving the lives of women and girls is a huge priority for Sightsavers. We commissioned a close look into what 17 project evaluations revealed about our effectiveness in meeting the needs of women and girls. All thematic areas were represented, spanning 15 African and South Asian countries in evaluations conducted between 2018 and 2019. The good news is that school enrollment for girls with disabilities increased. In our education projects, stigma for girls with disabilities decreased. Half of the eye health projects delivered an equal proportion of services to women and men. Our neglected tropical disease programs all showed strong evidence of equitable service delivery in regard to both mass drug administration coverage and trachoma-tracheosis surgery. And we have made major improvements in collecting sex disaggregated data. So how did we do this? Project staff met with organizations of women, disabled people, and the elderly to understand the barriers and consider ways to work around them. Our projects raised awareness and mobilized women and girls to seek our services through women ambassadors and other local leaders. For example, sometimes local leaders were used to convince husbands to encourage their wives to take medication or have surgery. Our projects adapted their services to the needs of women and girls. For example, by organizing the timing of surgery to accommodate women's household responsibilities and providing menstrual products for girls in school. Our project teams planned their gender strategy based on sex and gender data and translated this local data analysis into equitable targets. In one instance, this meant setting eye health targets of 65% women and 35% men. But there is still a way to go. We are still working on closing the gender gap for cataract surgery, and many projects still target men, women, girls, and boys the same, even when we have data to show their needs are different. To achieve equality, we must set targets that reflect the actual prevalence of conditions and diseases, articulate gender strategies at the outset based on contextual analysis of need and barriers, improve the availability and use of sex disaggregated data and gender analysis. Monitoring and analysis of data should be interpreted routinely for real-time learning and adaptation of project interventions. And finally, we must continue to highlight gaps and get better at broadcasting the best approaches for women and girls.
Find out more, go to evaluations@sightsavers.org.